All right, again, for the record, we have CEO Esther Munoz here to speak about general COVID updates, and as well as the representative from HHS, Dr. Richard Brostrom. CEO?
Okay, all right. So just a brief update on what we have shared to the media last night. 332 confirmed cases from December 1st to 7, totaling 1,514 since our community case was identified back in October. So basically about 496 recoveries were made, leaving 725 active cases and an additional 2 deaths. As of yesterday, December 9, there are 12 individuals hospitalized, 8 unvaccinated, 2 vaccinated, 2 partially vaccinated, and 0 on a ventilator. 1,223 new cases since October 28, of which 710 were identified via contact tracing, 500 via community testing, and 13 via travel testing. We continue to encourage our residents to practice the 3 W's of washing your hands, wearing your mask, and watching your distance. We are also pleased to announce that there will be antigen testing with the defense in collaboration with the Governor's COVID-19 Task Force and Department of Fire and Emergency Management Services. We are expanding antigen testing to be available at the Garapan, Susupi, and Catman fire stations. And this will be available Monday, Wednesday, Fridays, 8 o'clock to 4 p.m. More details on the initiative will be released later on today. We want to encourage and urge individuals with our community cases here in the CNMI that we have to start considering and really moving towards living COVID safe. As we continue to live with the realities of COVID-19, we will be releasing educational materials on how to live COVID safe. Part of this will be adjusting quarantine protocols to include home quarantine and home isolation. For the most part of this, a lot of what we have been sharing will continue to remain the same, which is basically getting vaccinated. If you are not, wear a mask, stay 6 feet away from others, wash your hands often, hand sanitize, and of course, the additional precautions that anyone can take, which is avoid crowds and poorly ventilated spaces, cover your coughs and your sneezes, and clean and disinfect high-touch surfaces daily. Also monitor your health for symptoms daily. We also want to, sorry, you made me laugh on this one. We have monoclonal antibody treatments for those who qualify, and yesterday 21 treatments were administered, and we have enough for those who qualify. Okay, and I guess I also, to explain, there's a lot of concern about what exactly is quarantining and what does it mean to isolate. For those individuals that have been identified as positive, there is a need to isolate, and the isolation is a 10-day requirement if they have not had any symptoms. Now, if they do experience any symptoms, there is a requirement for 10 days after that onset of symptoms. There is also I want to also kind of express the need to inform individuals of when to get a test. We have exposures that may have occurred only recently, let's say a day. We want to remind individuals that there is a need to wait for 5 days after exposure so that we avoid a false negative, and that if you are indeed infected, we can clearly detect that. And we will add on as we go along. Maybe Dr. Brostrom, you want to add something, or I don't know.
Well, thank you.
That's all right.
Clearly, CNMI is in the midst of their first real big surge. The surges that have gone through in Guam and in Hawaii. And when this occurs, it's quite difficult to continue that heroic work of following every case and tracking every case and putting everyone into isolation in the government hospitals and the system can get bogged down. And so as has happened across the US and every other place, the departments of health, with cooperation from the community and other agencies, begin to move towards more of a isolation at home when it's appropriate. I think the CEO Munya has mentioned for those that need a hotel to isolate in, that's still going to be provided.
Mhm.
But for the majority of people who feel okay, can be in a room by themselves, can minimize contact with the community and get help from their family, the home is the best place for them to be.
Right, and so the criteria for that is that you are vaccinated, fully vaccinated, and you are asymptomatic, and you are you have the ability to isolate. So it is, it is not for everyone. We understand that, and we also want to go back to also looking at close contacts. So close contacts, which we sometimes call PUIs, persons under investigation, if you want to call that. The idea here is that even if a close contact, based on CDC guidelines, a close contact who has not been detected as infected yet can still, be able to, especially if they're fully vaccinated, they have to be fully vaccinated. They can go to work. They can do everything. They just need to make sure that they mask up, practicing the 3 Ws. These are individuals that are fully vaccinated. They are considered a close contact, asymptomatic, and they can go to work. They can go to work. They can do everything they can do, basically like anyone else, until they are detected and tested for whether or not they have COVID-19. But again, it is very critical on the timing. We don't want individuals to get tested too early. We want to make sure that we test and we are able to detect and have a rapid response to help them out and provide the services they need, which could include monoclonal antibody treatment.
Clearly, there's lots of public information and public education that we need to continue to share. This is simply the first of several efforts to begin to implement more of a community-based policy, which we think is going to ease some of the concerns of the community and still address the needs. One of the key components of this will be the community testing piece.
Yes, and so that's one, having a rapid testing is important. We want to bring these tests to the community, and this is why we've been working with the Department of Fire and Emergency Management Services. They are located in Garapan, Susupi, and Catman, and they will be conducting these tests Monday, Wednesday, and Friday, 8 to 4 p.m. This is a rapid test. It's an antigen test. It is, if you are, let's say, for example, you got a negative test, and especially if you have symptoms, you may have to come back and get tested again. That is the antigen test. PCR test, which is the gold standard, still could be conducted at the community-based testing site at PIC, and that is available, I believe, 12:30 to 2:30. We'll get the details of that time, but that will be available, and that is the gold standard of tests to make sure that we can definitely detect the virus if you are indeed infected. The antigen test for if you want to quickly find out and you are not you couldn't get on the. I know there's a lot of interest to get tested. That is the place to get tested. Especially if you need a result right away. It's a 15-minute test. You get swabbed by the defense fire staff, and they will be able to give your result right there.
Part of that continuum for the community may also include some treatment that is not necessarily going to be at the hospital. So if individuals that are tested and are positive, if they're sick, of course, CHCC is going to manage them as they have been and doing an amazing job. with the clinicians that are there, as well as the clinicians at the off site at the old Kanoa Hotel. I have to say that the staff there, we've been working with them this week, amazing, determined medical staff, both nursing and physicians, really heroic work being done here as the surge ramps up in CNMI. However, I think there's a great medicine that folks can avail themselves of that is a monoclonal antibody treatment. It's been used across the country. It's been used in the Pacific, even in Palau and often in Guam as well. And this is a treatment for those that are positive and have some symptoms. And this medicine can help keep them out of the hospital. Okay. So if they're sick, of course, then they need to go to CHCC. If people have very mild symptoms, and maybe they have diabetes or they're overweight or have high blood pressure, then they would qualify for a treatment that's given at that site and would be given as four injections given at once. Not bad. And then they're watched for an hour and they go home. And this medication can protect them from having to come into the hospital. And we brought over 500 doses of that with the federal team, and there's federal teams down there administering this medicine. That's the medication that CEO Munya had mentioned earlier, where 20 cases were treated yesterday. So that team can go up to 50 cases per day. So that should be ramped up and ready for the community.
That is not a replacement of vaccines. So just wanted to express that also. This is to supplement the treatment, especially with additional armory, if you want to call it, to fight the COVID. And again, it is to prevent hospitalizations, not fill a bed. And of course, again, if you have symptoms, if you already have COVID and you have symptoms, you really should be, you may be a candidate for this, especially if you meet the high risk criteria of maybe, age 65 and older, is overweight or high risk, which means that you have diabetes, hypertension, and other diseases.
Yeah, and for those that did have the vaccine already, thank you for protecting yourself, but also for protecting your family and your community. That's the reason to get the vaccine. And for those that haven't, I think there have been some near record days for the vaccine administration here, including lots of people who had not had it before, who have finally changed their mind given this new surge of cases. And so there are folks that are getting their boosters. There's never been a better time to have your booster finally. And young adults that are getting their vaccine now, as well as adolescents. So there's another federal team there to help the CNMI team. And although CNMI has done an amazing job of being vaccinated, one of the highest in the world, everyone should get that shot to protect themselves. So please, number one thing you can do now is to get the vaccine if you haven't, or get the booster if it's time.
That's right. That's right. Thank you. Okay. I think that's, yeah.
All right, partners, we'll open up the floor to questions. Please raise your hand and I'll certainly call on you. Yes, Tomas?
Hi, CEO and doctor. I just wanted to ask, when will the home quarantine take effect?
That's actually taking effect already for anyone who qualifies. So the communicable disease investigators or surveillance team, or they are also called, they are looking at the qualifications. For example, first of all, they have to be fully vaccinated. That is the key information that we need to make sure that they qualify. Then on top of that, they are presenting without symptoms, and they are going to be also interviewed, because again, some people may have that they are fully vaccinated. They're not presenting with symptoms. However, someone in their family may not be vaccinated, or someone in their family may be immunocompromised and they cannot isolate and be there. Then they would have to be taken to the quarantine side, the isolation side. This is for positive cases who are fully vaccinated and who are asymptomatic and can able to isolate. For those persons, PUIs or close contacts, if they are fully vaccinated and again asymptomatic, that is something that we already implementing already. They are not are being quarantined. They're not being told to quarantine at a government site or even at home as long as they continue to practice the 3 Ws. These are for the close contacts who have yet to be identified, tested for COVID. The testing again is there's a certain time frame that we need to be able to test, and we need to do that likely on day 5. That's unless they have symptoms. There's a difference between exposure and having symptoms and someone with exposure and having no symptoms. So having exposure, being exposed but no symptoms, then we would test them on day 5. Having exposure but with symptoms, we could actually do the test right away.
And CEO, as I'm sure you recall, at the last press conference, you did mention that the CNMI does not have the monitoring capacity for home isolation. That was your response for when we asked about home quarantine last time. Obviously, things have now changed dramatically with this new effort. Can you address that in terms of monitoring and maybe some concerns? So this is going to be, it seems like a completely based on the honor system as well.
Correct. I mean, you know, there needs to be always adjustment. You know, at the end of the day, we want to be able to make sure that our goal here is about saving people's lives, right? And we want to be able to do our job efficiently. There's a lot of concerns about, you know, individuals who are fully vaccinated, asymptomatic, and you know, staying in the hotel room. We have to also think about mental health. We also have to think about really what is best for the individual. The intent is not to put more burden on the individual who actually decided to go and get tested, and you know, so that he can stop the spread. This is a collaborative effort between us and the person who has been identified as infected with SARS-CoV-2. We need to, yes, you know, we talked about this when the cases were small and we were identifying individuals at the quarantine site. We still believe that the quarantine site or the isolation site is a great place because the treatment is there. But at the same time, we also don't want to have individuals there that do not need the treatment. And we want to be able to do this efficiently and be able to continue to save lives. And that's been always our goal. And we want to make sure that it's the right time to make changes. We've always talked about pivoting. We've always talked about, you know, when is the best time to do this? We knew we were going to get here. Just the right time to do it is, you know, when can we determine that? And I believe, you know, with consultation with HHS and CDC, we agree that this is the best time to do it.
Does this impact the travel protocol, given that now the community can self-isolate, or is the travel protocol still in place?
It's still the same because, again, you know, you remember this is about risk. When individuals are close contacts, that is the same as travelers, right? They are basically also may have a risk of being a close contact with others that may be positive. So there's no changes in the travel protocol.
All right, thank you.
You're welcome.
All right, Sally, I saw you raise your hand. Do you still have a question?
Hi, good afternoon. Thomas already asked my question, so thank you.
Got it. All right, any other media partners out there with questions?
If no other people have questions, I have more questions.
Go for it, Tomas.
It's just wanted to speak with address the doctor. Are you part of that same team that we met with the other day, the disaster medical assistance team? I'm not sure if I saw you there, but are you part of that same team? And what were you brought here for a particular reason?
Well, thanks for your question. The answer is yes and no. We do represent the federal response, and that federal response was divided by The disaster medical assistance teams, which are here, are obviously giving shots and also implementing that monoclonal antibody treatment down at the ACS. And then additionally, CDC was requested to add on, including Dr. Hancock, who's in Guam, and myself to also help with implementation and add additional subject matter expertise where it was felt to be needed.
And I did want to ask about the capacities. Do you have the, given that this is in effect, what are all of the 3 quarantine sites full now? Do you have the numbers for that, CEO, or is that something that we should ask the task force?
Yeah, it's something I can get for you, Tomas, later.
Okay, because have some people been let out of quarantine after this? Because this has been, how long has this been in effect just the past week or?
Actually yesterday.
Okay, so were some people let out of the quarantine sites after this took effect?
Yes, and these are the individuals that are, again, are close contacts. The close contacts who are fully vaccinated and are presenting without symptoms. And again, just kind of remind everyone too that even if you're a close contact and you have symptoms, we want to get the treatment to you. This is not about giving you a pass to go home, so and you don't monitor your symptoms. You still need to monitor your symptoms. As a close contact, you still may get it, and you want to make sure that again, if you are feeling mild symptoms, you get, especially if you're putting on your mask, you want to be able to make sure that you don't spread it to others. And so you really need to monitor your symptoms. When you are given the home isolation orders or the home quarantine orders, it is really, really critical that you do monitor your symptoms. Because again, we want to be able to test you right away. We don't have to wait till day 5 to test you. We can test you right away and be able to make sure if you're positive, we want to be able to provide you the treatment. This is about focusing again on saving lives and preventing hospitalizations. Our numbers have to be in the double digit. That is concerning. We've always said in the beginning that we want to make sure that as much as cases continue to rise, we also want to make sure that we don't have high hospitalizations. And we are seeing a double digit is concerning. It is it's the great. We're lucky and that no one is on the ventilator, but still, there is a concern on and we want to have the best outcome for anyone, whether they're a positive case or they're hospitalized. We want to ensure a better outcome. And this is the way to do it, by making sure that individuals that are asymptomatic are fully vaccinated and have not, be able to isolate. We can focus on those individuals that are symptomatic, that need the care that they need right away, so that they can have the best outcome out of this, being infected by COVID.
And just my last question, I know we've talked about the positivity rate. You mentioned double digits. When will we know that we're on a downward trend? I don't want to say in the clear, it's unpredictable. Just for instance, we've seen other jurisdictions say if cases are below 25 for a matter of 7 or 10 days, then we can say, okay, we're kind of getting to a place where we will not be in a surge. What are some of the numbers and figures that you're looking at? Is it the positivity rate, daily case reports? Can you explain?
For me, again, for our health system, we're really focusing on the hospitalizations as well as making sure that everybody has a best outcome out of this. There's a lot of we did change in our reporting about those that have recovered. That's because that's what we are really looking at, is trying to get individuals to have the best outcome, which is recovery and not getting hospitalized. And of course, I'm going to ask Dr. if you want to add anything else.
Well, right. The decision about when the surge actually ends often is as you mentioned, is difficult. Probably we won't use strict numbers because it's a small jurisdiction and the numbers can be quite variable with a small outbreak. With each small outbreak would likely push you past whatever your baseline is. But at this point, there's no doubt that the surge is on. It's kind of unfortunate in that it could very well carry through to some of the holiday times. I wonder if CEO Munya could talk about
Yes,
safe holidays.
Safe holidays, yes. You know, we really want to, again, you know, if you're not vaccinated, fully vaccination is really key to having a safe holiday also. That is definitely a key. That's already, you know, you can see that in the CDC guidelines. Mr. CDC here, Dr. Brostrom, you know, there really is a need to get vaccinated if you want to have a safe holiday. You want to be able to, as much as possible, you know, we mentioned about outdoor gatherings and you know, have better ventilation. We need that. And we want to be able to make sure too that, you know, you protect your family. You know, this is your family. This is what is today, December 11? December 10? December 10. There's, you know, 14, 15 more days to go. And please try to avoid it. I mean, you know, once you're in quarantine or in isolation, you really need to separate yourself and you want to spend time with your family. And the best way to do that right now is really to try to avoid the spread. And so that individuals don't have to be in a hospital bed and be getting treatment. And we want, again, to have the best outcome for our people here. And we really want everyone to protect each other. This is our community. We've always talked about protecting each other. That's always been our tradition, our culture. Let's do it. You know, let's help each other. And you know, there's, you know, people talk about masking and being fully vaccinated, masking, practicing the 3 Ws. That's the way to protect each other. So, you know, let's just do it all together. And I believe we can all have a safe family gathering with you know, and enjoy the holidays without hurting or, you know, putting someone at risk. It's all about risk. Everything you do is all about reducing risk. Putting a mask on, both of you putting a mask on is reducing risk. Getting vaccinated is reducing risk. Protecting those that can't be vaccinated, because there are some people that can't be vaccinated. We want to be able to reduce the risk so that we can all have a great holiday and a safe holiday with our families. Thank you.
Thank you. That's all the questions I have.
All right, any other media partners out there? If not, we're going to go ahead and.
Let me say one more.
Yes.
Sorry.
Just
again on, you know, I have been receiving a lot of questionnaires or questions about, I've been receiving a lot of questions about, you know, the workplace. There's a lot of employers are concerned, of course, because of individuals that have been identified as close contacts. I have been providing guidance. It's from OSHA and also through CDC about workplace safety. It does say that and again, it is really encouraging to see that a lot of the companies here in the CNMI are fully vaccinated. That is the way to have a safe environment, safe workplace for your employees, is getting all of them fully vaccinated and then able to make sure that you practice the 3 Ws. If you are a contact, a close contact, and if you are enforcing the masking, the watching the social distancing, and you have your staff fully vaccinated, you are doing a great job to make sure that you continue to remain open and be able to provide services to the community and, you know, and have your business and keep the economy going. So that is in the OSHA guidelines. That is also in the CDC guidelines. That is what we can follow. And that's also one of the reasons why we are allowing the, you know, self-isolation or home quarantine, and be able to basically say not, you know, just because you're a close contact, we're going to put you in the quarantine site or the isolation site, because you are, you know, practicing, you're already doing some things that basically reduce risk. And that's what it is all about, So those are available. We can share the website information from OSHA. We can share the website information that specifically talks about workplace safety. And it's only those that are detected or have been identified as positive. Those are individuals that should stay home, or in some ways they could be home isolation, or in the quarantine site or the isolation site. And also those that have symptoms. If someone is coughing in the workplace, I really do encourage employers to have, to find ways to make them stay home. And, I hope that it doesn't affect the individual economically, because obviously it's going to cost money, but if they could stay home, and it reduces others from getting infected as well, so you don't have to close the entire business. So that's just my recommendation. Thank you.
And apology, CEO and doctor, I just saw a notice about the CDC expanding COVID-19 booster recommendations to 16 and 17-year-olds. Can you talk about that? Is that going to be done here in the CNMI? I know we're on short supply as well. I know this is only for the Pfizer vaccine at the moment.
We're getting our supply. It's a little late. It's just some delays, but we're getting it, right.
Yeah.
But once you get your supply, you're going to start administering it to 16 and 17-year-olds here right away?
Yes. Right now we do not have Pfizer in stock, but once we get the Pfizer vaccines, we will definitely. It's open to anyone that walks in. As soon as CDC says it's good to go, we always do it right away.
Okay, so can you just share how many doses and when it's coming?
We have about 4,000 and another 2,000, maybe 7,000 doses.
Yeah.
Yeah.
Of Pfizer specifically?
Pfizer specifically.
Mm-hmm.
Okay, all right, thank you.
Yes. We also have the prophylaxis approval.
Yeah.
You want to talk about that?
Monoclonals?
No, the antivirals is the prophylaxis for the 24 and stuff.
Yeah.
Maybe you could go there. If you want to talk about it.
There's new approval for medication for those that are immunosuppressed. It's a brand new medication that is going to be distributed across the U.S. and will include CNMI, just like New York, just like California. It'll be on a pro rata basis. There won't be a lot of it, but that's for folks who are severely immunocompromised. And as you mentioned with the vaccination, which is still the primary method of protecting yourself from getting COVID or getting severe COVID or being hospitalized from COVID, there was a request from CNMI, a special request that went through and was approved, and those additional doses are as approved, are coming to CNMI.
All right, thank you. That was my last question.
All right, thank you. All right, I'm good.
All right, media folks, if there are no other questions, we're going to go ahead and wrap it up. We do appreciate you folks again joining us for these updates as we send them out. Again, I'll send out that release shortly on the antigen testing in collaboration with DFEMS. If you have any questions or any follow-ups, please feel free to email me. You have my email, or call me at 789-2254. Again, thank you and stay safe out there.
Okay, bye-bye.